if you are looking for the program, Why Can't I Stay Positive? Then you are definitely in the right place. My name is Lauren Listowskis. I'm the VP of Community at Grit Health. I'm a cervical cancer survivor, and I'm here to help with our program tonight. There will be a couple polls throughout the Zoom. Those are completely anonymous, but we would love for you to answer those polling questions as they go along with Kelly's presentation. And as a reminder, all of Grit Health's programs are meant to be informational. Any decisions regarding your care should be made with your medical team, as always. And I will let her get going. And thank you all for joining us.
Thank you to Grit Health for inviting me to be part of this. My husband died as a young adult from cancer, actually 13 years ago tomorrow. So you'll hear me mentioning Justin throughout the presentation as he relates to my story. But so young adult cancer needs has always had a special place in my heart. So you'll hear more about that. And just quick hello to all my friends in the Quad Cities that I saw in the waiting room earlier. So we're focusing on why can't I stay positive? So we're gonna be talking about depression, grief, resilience. And I just wanna level set too. Grief, it doesn't have to mean a physical death. We're gonna talk about that. But with the cancer diagnosis, as you all know, if you're the patient or the caregiver, grief comes and goes throughout your diagnosis. You're hit with grief the minute you're diagnosed. If you have a bad day, that can lead to some grief. You've got a lot of losses in your life. And we're going to talk about all that. Everything's pretty fair game in this presentation. So I come from the cancer support community. You might have heard of either CSCs or Gilda's clubs. We're all one organization, and we're a global organization whose mission is to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. I myself am a social worker by background. I'm licensed here in the DC area and also still back in Iowa, where I just moved from a few years ago. It feels like yesterday. But we're going to set the stage a little bit about talking about loss. We'll talk about depression and cancer, grief and cancer, resilience and cancer. And then I'll share a few slides at the end just with some additional resources from the cancer support community. You've got to pull up on your screen today. This is a snapshot in time. Today, which of these universal challenges of grief, of living with cancer, do you most relate to? And if you're the caregiver, you can answer that too. All right, so a lot of people are resonating with living with uncertainty today. Not a lot of financial burden concerns today. Unwanted aloneness, loss of hope, and loss of control are some other resonating feelings. So we're going to move on and start talking about some of this now. There's all these different universal challenges, though, of living with loss. And every day it could be, or living with cancer, I'm sorry. And every day this could be different throughout the day. The challenge you resonate with most could also change throughout the day. Here's some other kind of typical feelings that we see as top 10 concerns from people diagnosed with cancer. And this comes from our Cancer Experience Registry tool. So this is 2020 data, but as you look at this, a really common concern for people with a cancer diagnosis tends to be eating and nutrition, fear of recurrence, worrying about the future and what lies ahead. Many of you commented on that one in our little poll. And I'm sure as you look through this list of 10, there's a lot of different ones that you can resonate with here too. When we dive a little bit more into the data, we do find a lot of consistencies and common factors for both patients and survivors. So another thing we find is that 49% of our respondents are also at clinically significant levels for anxiety. They're also at 38% significant levels for depression. So Cancer Support Community and Gilda's Club, we are a psychosocial support organization. So we very much focus on the mental health of anyone impacted by a cancer diagnosis. And so these are things that we watch for triggers for, and we try to make sure that we're finding different ways to support people through this, through support groups, education like tonight, and then some different resource referrals as well. A few other findings that we've noticed as far as common themes for a person diagnosed with cancer. is that 49% of our respondents were substantially worse in their anxiety levels than the national level, the national average. 34% reported they had substantially worse fatigue than the national average. And then when we start looking at caregivers, and this is all now we've shifted to caregivers, when we focus more on them, 39% said that they, didn't know what they were doing when they started to become a caregiver, essentially. And I know I was one. I was 27 years old when I became a caregiver to somebody with terminal cancer. I didn't know what I was doing with my life, let alone somebody else's at that point in time. So there's many people who feel very unprepared to go into a caregiver role. And that's where we start thinking about some of these uncertainties from both the person diagnosed and the caregiver perspective. So as I'm kind of mentioned earlier, there's a lot of worry about the future. Our respondents on our registry, that was 53% of them. There's also the concern that you have to put plans on hold. Treatment, will it stop working? Will the cancer come back? All really real, valid feelings. And so on top of that, we have a lot of unmitigated distress. And our resources, kind of, you can see this emptying fuel tank on the screen. We get depleted by the fact if we're not managing our distress in a healthy way, if we're being untreated for depression. And I just want to pause real quick too. One of the silver linings of the COVID pandemic has been that, as a nation, we've realized that we need to talk more about mental health, which is another great reason why this series is happening from Grit this month. I really am hopeful that that's one of the silver linings of the pandemic is some of the stigma about talking about your mental health needs has maybe been, if not eliminated, decreased. Unrecognized grief, that can also deplete our resources. So can limited support systems. So as we explore that a bit more, distress is really a mix of, it can be anxiety, it can be, it can cause lack of sleep, lack of appetite, you can have trouble concentrating, just have trouble carrying on any of your normal activities when you're feeling distressed. Those are some common triggers. And even though some level of distress is normal throughout the day, about a third of cancer patients experience significant amounts of distress. Only about 5% of those with cancer obtain psychological help, though, for that distress. So while distress doesn't affect cancer itself, it does affect how patients and caregivers cope with the cancer diagnosis and ability to even follow up with treatment recommendations. So some different predictable points of distress, which are highlighted on the screen here, is, these are some of your common emotions, but it's common to feel some of this distress when you're diagnosed. If you're at a situation where you're needing to make a treatment decision, if you're out of treatment and it's been 10 years and you're going back for that scan to see if everything's okay still, that scanxiety, and then just the recurring fear of cancer progression. So one thing we do at Cancer Support Communities and Gilda's Clubs is we have a distress screener. And this will flag people who are at risk. It's not a clinical diagnosis, but it flags people who are at risk for anxiety and depression. So we're going to leave this screen up and bring up another poll question. And I'm going to give you a minute here to think about this. As you're looking at this screen of questions, there's 16 items here. Think about how many you would rate as being moderately to very seriously concerned about today. And you can just start responding to the poll as soon as you start digesting this a bit. And I have seen a lot of 13s to 16s when I do this poll. I have seen some people with none. So it's really normal as these start coming in that we're going to see a range. And as you're looking through this too, if you are finding that you are somebody with a lot of moderate to very seriously, that's just a reminder to have a discussion with somebody in your family, talk to your healthcare team to make sure that they're informed about how you're feeling. And the 16 items that you're seeing, these are also a snapshot in time. So that's why I stressed in the beginning when you started looking at this, how are you feeling right now at this moment? But you can see that a lot of people, they are really hit and concerned with many more than just a single item on this list. So the purpose of the slide was just to kind of normalize that we're all in different places and it really can vary quite a bit from day to day. So I'm going to share those results for you. Nobody was a nun. That's very rare that I give these presentations and I have somebody that comes up as a nun. I have several that I can mark on this list myself. But a very good mix of people who are feeling anxiety and distress. So again, just a reminder, there's several reminders throughout this presentation because again, I'm a social worker. This is Mental Health Awareness Month. We're going to do lots of reminders that it's okay to reach out and get additional support. So if you do have a lot of distress and anxiety, either around your own cancer diagnosis or family members, just make sure you're reaching out and talking to somebody about that. All right, so there is a burden when it comes to being overly positive. Some people call it maybe a Pollyanna syndrome, if you're familiar with that old movie. But I want you to all just kind of think a minute about how often people have said to you, everything will be fine, just stay positive. You know, it's really can be hurtful and traumatizing to hear that day after day if you have a cancer diagnosis. I was just commenting to Lauren before we started this call that, you know, I had people tell me right after my husband's death, well, he's in a better place. And their point was to get me thinking positive. It did not help me at all. So what's positive for one person isn't for another. And I just needed to be allowed to feel how I was feeling. And there actually is no evidence that a high level of optimism prior to treatment is going to enhance survival in patients. And this is based on a study with non-small cell lung carcinoma. Apparently I can't speak tonight. And encouraging patients to only be positive, that can actually add to their burden. It can add to their anxiety and distress. So this burden of positive thinking is you look at the different squares across the screen here. Just think about what they mean to you. You know, informing, you know, thinking about being too positive, it really impairs the ability to acknowledge that cancer is difficult and frightening. It takes away the validity of anything else you might be feeling. There's an insistence that you have to put on a happy face. And as the cancer patient, if people are encouraging you to be positive, it turns into you being the caregiver and you need to be focused on yourself. Same if you're the caregiver, your number one concern is, you know, yourself and that loved one with the cancer diagnosis. You can't be worried about what other people around you are thinking. Being overly positive also leads to feeling of being guilty if you can't maintain that positive attitude. And then it just creates this belief that ranges of emotion aren't acceptable. And we want to make sure that it is normal for people to express their feelings, to be able to put a name to how they're feeling. That can be quite powerful in itself. So we're going to take a moment to do a little reflection. So before we bring up our next poll, just take a pause, maybe do a few inhales and exhales to center yourself. If it helps, if you're not a deep breather, inhale to a count of 4. Hold for a count of 4, and then exhale for a count of 4. So anytime we get to a reflection slide, we're going to do that to just kind of recenter ourselves. We can go ahead and bring up the next poll question. So how often do you feel pressured to think positively about either your own or your loved one's cancer diagnosis? So again, we have a range. Nobody said never. But some of you rarely experience this, which is great. That's really good for your own emotional health if you rarely feel this pressure. But many of us, there's variety here. Sometimes, often, always, quite a few always on this response too. And then just think, I'm going to give you another minute. I'm going to watch my watch here. Think for a moment here about how that physically makes you feel when people put pressure on you to think happy, they tell you to smile, something like that. Or if they force you to think about the silver lining in your diagnosis. So we've kind of set the stage a little bit. Now we're going to talk specifically about depression and cancer. All right, so if we want to get technical, the depression is measured if an individual is experiencing 5 or more symptoms during a 2-week period, and at least one of these symptoms is either depressed mood or loss of interest or pleasure. So if you have a depressed mood most of the day, nearly every day, if you have markedly diminished interest or pleasure in all or most of your normal activities, nearly every day, if you've had significant weight loss when it's not due to dieting, or opposite, you've had weight gain, if you've had changes in your appetite, you might notice that you have a slowing down or a reduction in your physical activity. And oftentimes this gets to the point where others observe that decreased activity. You might notice that you have fatigue or loss of energy nearly every day. Feelings of worthlessness or excessive or inappropriate guilt feelings nearly every day. It could be diminished ability to think or even concentrate. If you're an indecisive person already, that gets exacerbated to the fact where you can't function. You might have recurrent thoughts of death or even recurrent suicidal ideation. You might not have a specific plan, but any of this really shows signs that you could be clinically depressed. To really get a diagnosis, though, of clinical depression, these symptoms cause an individual significant distress or impairment in social, occupational, or other areas of their life. Symptoms also are generally not the results of substance abuse or another medication, although we know that depression can lead to substance abuse. So if these are signs that somebody, either yourself or someone you know, is experiencing, they are pretty normal, but they are also very good signs that you should be talking to somebody before they get to the point where you can't function in your life. So think now a little bit about how depression feels like. We all have depressed moments, but when we're talking about depression from a clinical standpoint, we're talking about these prolonged periods of times where we're having multiple symptoms. So there's mood-related symptoms of depression, feeling sad, hopeless, irritable, numb, worthless, or feeling down. But then there's physical symptoms too. Insomnia, hypersomnia, which is feeling sleepy most of the time. It could lead to sexual problems or lower sexual desire, appetite loss. I feel physical pain in my body when I feel myself getting too overwhelmed or feeling depressed. And then there's a lot of behavior symptoms too when it comes to depression. So you might cry. That's probably a good sign that there's something wrong with me. My friends joke that I'm from Wisconsin originally. My tear ducts are frozen. You might have a loss of interest in activities that you normally enjoy. Feel yourself withdrawing from friends or family, and they might notice it before you do. And then just loss of motivation to get through your daily activities. Then there's some cognitive symptoms. So in extreme situations, these may include thoughts that life is not worth living or of hurting yourself. More commonly, some of the cognitive symptoms, though, are memory problems, trouble focusing, difficulty making decisions, and negative thoughts. So we've got some more statistics to share with you on this next slide. It's very common that approximately a third of cancer patients report either a mood disorder at some point after their diagnosis. With the first year after diagnosis, this poses a greater threat. And then between 10 and 20% of cancer patients continue to report depression, anxiety after the initial stress of the diagnosis or recurrence. Additionally, more than half of cancer patients and survivors report fatigue as an ongoing issue. And then a large number of survivors continue to struggle with pain and isolation after their diagnosis. So this is still additional data from our 2020 Cancer Experience Registry. But depression can really impact a cancer patient's life in a variety of ways. It impacts quality of life measures. It might lead to a decrease in adherence to your cancer treatment. You know, if you're really depressed and not functioning, are you going to remember to take your medication? Are you going to remember to get to that next follow-up appointment in time? And then oftentimes this can lead to longer hospital stays as well. So just another reminder, we said that there would be plenty throughout this presentation. If you or someone you know is really struggling with some of these signs of depression, they might not be clinically depressed, but they should still reach out for support. So here's what we know. Depression is treatable. So in addition, patients might benefit from a range of approaches that include relaxation strategies, more in depth than that quick deep breathing exercise I did with you. It could involve psychoeducation. There's cognitive behavioral therapy or CBT, problem solving therapy or PST, and acceptance and commitments therapy or ACT. So just to run through these a little bit, CBT identifies and equips patients with skills to overcome maladaptive thought patterns. It encourages emotional readjustment. And that's adjustment. We're not focusing on too much positivity again. And then both psychoeducation and CBT have been demonstrated to be effective in improving depressive symptoms and quality of life. And then ACT, that teaches patients how to tolerate different thoughts without being overwhelmed and dominated by them. It really is developed psychological flexibility. So ACT has been demonstrated to be effective, to be an equivalent rather to CBT in terms of its effect on mood and quality of life. And then really a combination of therapy and medication can be most effective. Medications may not be available due to other medications you're on for your cancer treatment. But it's very normal to seek treatment for depression, including medications for mental health during your cancer experience, during your caregiving experience, and other periods in your life where you have distress. So again, just a reminder, make sure you're talking to your healthcare team about how you're feeling. There are many different types of medications. We've got several different types listed on the screen here. But different types of antidepressant medications are available. Your doctor will be familiar with your cancer treatment plan and make sure that they're finding something that works accordingly. So they're going to look at your needs, potential side effects, other medications you might be taking not related to the cancer, your medical history. The selective serotonin reuptake inhibitors, or SSRIs, they're generally the first line for depression, for treating depression as an antidepressant. And that's because they tend to be more tolerable. But talk to your doctor about all the medications you take, the supplements you take as well. because they can be, there can be different impacts with supplements that could interfere with an antidepressant. And then a lot of times it takes a good 2 weeks after starting an antidepressant medication for it to really kick in and feel some results. It can also take more like 6 to 8 weeks though for the medication to have full effect. So there is some patience needed while you work with your doctor to find the medication that works with you. I was on depression medications right after my husband's death. I think from what you've heard of this talk, it's clear that that's important to me, that I'm addressing my health needs. But I was on one that did not react well with me. I could not function. And so I just made sure I kept in touch with my doctor and was reporting the symptoms I was having. They pretty quickly got me on another medication and it worked much better. So you have to be an advocate for yourself, even when it comes to your mental health medications. All right, now we're going to shift gears and talk a little bit more specifically about grief and cancer. And I just love the quote on the screen: "We shake with joy, we shake with grief." What a time they have, these two housed as they are in the same body. And that's from Mary Oliver. And think about how true that is your life. You know, think about a time that you were extremely happy. Maybe it's when you graduated. Maybe it's when you were proposed to or did the proposing. You know, think had a baby, some extreme happiness in your life. You just can physically feel it. And then think about when
Here's what I found.
Apparently my Siri wants to chime in. Sorry about that. So think about when you were diagnosed with your cancer too. That had a physical reaction, I'm sure. If you are someone on the call who has lost a loved one, they've died from their cancer, you've shooken with grief in crying over that loss. So very powerful emotions. And again, we want to make sure that we're expressing our emotions. So there are many different kinds of grief. So one is called living with loss. This represents how we may experience chronic or ongoing sorrow. So it's kind of that space between what is and what could have been. It captures how you thought you'd be spending the rest of your life and compares it to in reality where things are. So it's kind of that fork in the road. You know, you're going in one direction, there's the cancer diagnosis, it takes you in another. You are newly married like I was, and somebody gets a terminal cancer diagnosis. That's some of that living loss. There hasn't been a physical death yet, but there has been an interruption to your life. Then we've got ambiguous loss. So this really involves a sense of loss. It might be unclear what it is. It kind of defies resolution, but we just feel a sense that there's a loss and might not be able to fully know exactly what we've lost. Which kind of complicates things too, until you maybe are further out and can process it more. You know, I know my husband, one of his ambiguous losses, and he realized this pretty quickly though, was his loss of independence. He was on steroid medication and couldn't drive. And that was very early in his treatment. So that loss of independence, realizing that it was independence he lost, took a while to recognize. There's also loss of the assumptive world. So we typically think of the world and develop assumptions or beliefs in our life that help us feel in control. They give us a sense of security or stability and really just kind of help us make sense out of life experiences. So for instance, if we work hard enough and we're a good person, then we'll have a good life. That's one example. So these are beliefs that can form our core beliefs in life about ourselves, about others around us, and then what happens in our life. But in the face of an illness or a struggle, these beliefs are really challenged, and it causes a feeling of disorientation. We may feel stuck and stuck in a pattern of trying to make sense of why we're going through what we're going through. There's disenfranchised grief. So this is when we feel invalidated or minimized, or feel like we can't publicly acknowledge that we're grieving even. So we might feel a sense of loss that's not recognized by other people around us, such as when people say, you should just be happy you're alive, right? That's one example. And they really aren't understanding why somebody might be sad that their cancer treatment has pushed them into menopause or prevented them from having children. So it negates a lot of those valid losses that we're experiencing. This valid invalidation is also what is considered maybe an appropriate or inappropriate sense of loss. It can come from significant others. Healthcare professionals can make us feel this way even. A lot of times it's unintended, but we eventually may internalize it when we try to talk ourselves out of feeling grief. And then there's complicated grief. So if you lose a loved one, this can be one of the most distressing and unfortunately common experiences that we all face. Most people experiencing normal grief and bereavement have a period of sorrow. There is no time frame on that period of sorrow. It's different for everyone. They might experience numbness, even some guilt and anger. Gradually, these feelings kind of ease and it's possible to accept the loss and move forward. I'll repeat that, move forward, not move on. I personally dislike the phrase moving on because it kind of gives the connotation that you're leaving someone behind. I heard a really great speaker talk once about the death of her husband where she carried him on in her heart. So I like to say moving forward or carrying on. But for some people, feelings of loss are really debilitating and don't improve after time passes. So that's complicated grief. Sometimes it's persistent. It can be considered a complex bereavement disorder. Emotions can be really painful and last so long that they're severe and you have trouble recovering from the loss, and it really encompasses and overwhelms your entire life. So complicated grief is like being in an ongoing heightened state of mourning that keeps you from healing. And then we have anticipatory grief. If you have a loved one with advanced cancer, you may have already been preparing yourself for the end of their life. So as your loved one's illness progresses, you even may already feel like you lost them as a person. And if that sounds familiar, you're experiencing anticipatory grief. So while it shares a lot of commonalities with conventional grief, some of the symptoms that are unique is because it happens before there is a physical death. So anticipatory grief can often be mixed with hope that your loved one will live longer or survive their illness, while conventional grief signals that a loss has already happened. So the National Cancer Institute goes on to define the most common symptoms of anticipatory grief as depression, heightened concern for the person who's ill, rehearsal of the loved one's end of life, funeral planning, maybe having dreams about their death already happening, attempts to adjust to the consequences of the loved one's end of life, anxiety and worry, increased irritability, and then just mourning changes in the loved one's personality or physical appearance while they're still alive and with you. But then there is hope. So please note, we're not talking about hope as wishful thinking. Hope is adjusted and adapted over time. Hope is the last thing to die, but it changes in its meaning. So hope comes in the form of self-compassion, caring for yourself, finding meaning in life, acknowledging what's happening and not avoiding it, trying to reduce isolation and be around your loved ones, and then cultivating resilience. I've heard people describe hospice as when there's no more hope. And I hate that because hospice is a different kind of hope. So hopefully, just real quick, we understand the difference between palliative care and hospice, because I often find people don't. Palliative care can happen at any point in a chronic condition. It doesn't have to just be cancer. It doesn't have to be a death, terminal illness at all. But anytime you're in a prolonged state of distress or in hospital care, you can do palliative care. It's comfort care. Palliative care is always part of hospice care because it's comfort care. Hospice is not giving up hope. The hope just shifts. Instead of hoping for a cure or a longer survival rate, your hope might shift to a good death where you're not in pain, you're still surrounded with either your family, or maybe you get to experience some really memorable last moments with your family. So hope fluctuates and we adapt with it. So we're just going to do another brief reflection. There's no poll with this one, but just think for yourself. And I'm going to give us just a couple minutes to make sure we don't run over on time. I'll watch my watch. What are you grieving? Again, grief does not mean a physical death. It can. That's okay if you're grieving a person. But what are you grieving right now at this moment? And then how can you honor and acknowledge your grief? So shifting modes from grief, we're going to talk a little bit about resilience. And it was very intentional that kind of was a bouncing ball effect on the screen there. I'm actually going to read this quote because there's some parts that I want to call out. So resilience refers to an individual's protective attributes and or personal characteristics, which are thought to be modifiable and to promote successful adaptation to cancer, including, among others, meaning and purpose in life, sense of coherence, self-esteem, self-efficacy, cognitive flexibility, coping, social support, and spirituality. So there are several ways to define resilience. This kind of ranges from bouncing back from adversity to positive adaptation or growth during a disruption in life. So there's a model of resilience that recognizes the way in which individuals experience the world before their cancer affects their response and ability to cope with cancer. So in this model, mindfulness is the foundation of resilience because mindfulness allows individuals to remain present, whatever the challenges in their life may be. But resiliency is a process. It happens over time, just like hope. It's something that's adaptable. So resiliency is many things. It is an active process of facing adversity related to a cancer experience. It's not something that people either have or don't have. It can be learned. It's the ability to restore emotional and physical functioning when confronted with a stressful time. It involves behaviors, thoughts, and actions that can be learned and developed by anybody. So cultivating resiliency through mindfulness is a really great example. Mindfulness can be helpful for a wide range of physical and psychological outcomes, including anxiety, depression, stress, fear of recurrence, fatigue, chronic pain, difficulty sleeping, and immune functioning. So mindfulness has also been related to increases in perceptions of social support, optimism, and overall quality of life. In mindfulness, it's that paying attention on purpose and being present in the moment without judgment. So we're going to do another short reflection. I realize I want to make sure we leave some time open for questions and comments. I want you to just briefly close your eyes if that's comfortable. If not, just a soft gaze down at the floor. Take a few easy, slow breaths. With each breath, trying to release any tension you notice in your body. Simply begin to notice your breath, feeling your stomach rise as you breathe in and lower as you breathe out. Notice the rhythm of your breath. It's natural that your mind might begin to wander. As it does, just gently remind yourself to return to the focus on your breath. Stay in this moment, gently breathing, connecting with your breath, allowing yourself to feel whatever it is you're feeling and to be present with your current experience. You can slowly open your eyes. There's 3 different actions that you can think about taking daily. So looking for the good is not positive thinking. I just want to clarify that. It allows for both positive and negative thoughts, thinking and feeling, but it acknowledges the fact that you're experiencing both. It's also about gratitude. So a lot of people, when they practice gratitude, they might write down 2 to 3 good things that happen to them every night before bedtime. It kind of helps to promote resilience and quiets your mind as well. So these 3 things you can do is look for the good, take 10 mindful moments, or do an act of kindness for others. So we have one final poll we're going to pull up. And which of these 3 daily actions do you think you can commit to over the next month? I'll give you a good amount of time to think about that. But we have a really good mix in the audience tonight of different ways that we think we can commit over the next month to taking one of these actions. For me, I tend to lean towards the look for the good side of things. So some key takeaways that I hope you've experienced. Stress and depression are treatable. Resilience can be learned and strengthened over time. Positive thinking is not the goal. We want you to be valid about your feelings and feel what you need to feel. Acknowledging grief matters. It's really important. And you don't have to do this alone. So in that mindset, I wouldn't be a good cancer support community employee if I didn't mention a few of the resources that we have. So we have a helpline staff. They're staffed by licensed mental health professionals. And their hours are Monday through Friday, 9 a.m. to 8 p.m. Eastern time, Saturdays from 9 a.m. to 5 p.m. Eastern time. We also have an online community called mylifeline.org. And it really helps people, both the person diagnosed and the caregivers, transform their experience through community and connection. We have our Cancer Experience Registry, which I shared lots of data from with you tonight. We have an educational series called Frankly Speaking About Cancer, and that is where this workshop came from, this toolkit. We also have a program called Open to Options. That is a great program for if you are making a treatment decision. Maybe you're newly diagnosed and not sure where to start. Maybe you've had a metastasis, or one treatment is no longer working and you have to consider other options. That's where you can meet with one of our trained facilitators. And it's an interview process that lets you leave the conversation after 45 minutes to an hour of talking with a really detailed list of questions, prioritized list of questions to go to your next appointment with. So it takes that jumbled mess in your brain and outlines it for you on paper. So I've got my contact information as well as our helpline number on the screen. I'm sure this is something Lauren and Chris can make available to you all later as well. But that wraps up my slides for this evening.
Thank you, Kelly. Thank you. Thank you. That was really informational, really helpful. As I was putting in the chat, and as a lot of our community members know, my mom was my caregiver when I had cervical cancer when I was in my early 20s. And then after about less than 6 months of being diagnosed with ovarian cancer, she actually just passed away on May 7th. So this was more than relevant for me. So thank you. I know I got a lot out of it, and I saw the chat was great. People really just resonating with so many different things that you hear depression or anxiety or grief, but you don't really know the ins and outs of it, all the little intricacies that can happen. So thank you. One of the questions that did come up when we were kind of talking about the positivity aspect of, you know, be positive, be happy you're alive, you know, smile more, you should be happy, right?
Yeah.
And one of the things I wrote is I had family that did that to me until I openly, adamantly, in my nature, if any of you know me, strongly told them that's not what I needed. But I know for some people that can be really hard. So do you have any kind of advice on how to have that conversation with a close family or friend that it's not helpful?
Sure. And I think role playing actually works wonders. You know, if you've got one great friend or family member that realizes that this has been a struggle for you, do some role playing with them. Have them play the part of that person that is being a little too overly bearing. They're well intended. They really are. They mean well, but they don't understand how much more stressful it can make situations for both the person diagnosed and the caregiver. So do some practice scenarios, and just be upfront and honest. Let the person know, I know you mean well. I appreciate that. But what I really need right now is to be real and true to you about how I'm feeling. But it does take a lot of practice.
Right. I think that's really important for yourself and then the person you're speaking to first start off with, I understand you're trying to be helpful or you mean well, but and then just open it up. I think that's a great way to start off that conversation. And then I know for me, if you're worried about emotions getting in the way, or you're going to get mad at them or cry whenever you're bringing this up, that if they're receptive to a note, a written out, telling them something, if you can't maybe say it face to face, if you're worried about that. Yeah, so that's great. Are there any other questions people have? The chat is still open if you want to drop another question or two. But outside of cancer support community, if you're kind of feeling like you're getting to that 2-week mark of depression, or the grief is really weighing you down and it's important to get help, say you call cancer support community and get started with that, but what if it's after hours or you need something a little bit more long-term? What do you recommend in that vein?
I think a lot of times we all have that go-to person that can be there for us at any hours. And it might not be your family members or who you immediately think of. There are some people, when cancer comes to us in our lives, that really step up and we form this deep connection bond that we never realized. So journaling at night when you've got thoughts that keep you up is always very common. If you've got someone you can pick up the phone and call. During my husband's hospice days, I was kind of going through a similar experience with another couple our age. It was the husband who was the caregiver, and we texted late at night to support each other as both of our spouses were entering hospice. It's just important that you find someone to voice things to. And again, it might not be the people you expect. It might not be your spouse. It might not be your parent. It might be that person you meet in a support group because they just get what you're going through. It might be a complete stranger who's just really empathetic and can hear you that day and not judge you. So just being open to having conversations with others is vitally important.
Right. Yeah. And I know, if just to get started on things, reaching out to cancer support community with the hotline or the community there is a great resource. And as you mentioned, like you said, maybe the one good thing from COVID is that people are finally talking about mental health, which is wonderful. But as some of you might know, since it is being talked about, it can be hard to get in, as a new patient to see a counselor or a therapist or something like that. And, but while you're waiting, however long to get in for an appointment, there are free resources out there like Cancer Support Community and others. So, there's help out there. There's communities out there. Grit Health, not just a shameless plug because I work for Grit Health, but we do meetups every second Tuesday of the month where we just come together, talk, be together. We also have a community platform and app that is open 24/7 where you can chat in chat rooms. And we also have Vivabot who lives there, who's a positive psychology chat bot. For those lingering 2, 3, 4 a.m. thoughts, she can kind of walk you through some resiliency skills there when you're in need and there's not a human around. Kelly, I want to thank you again and remind everyone we are here for you at Grit Health. We welcome you as you are with no expectations. And yeah, I'm just really happy everyone joined us tonight. And Kelly, I thank you again. Really great information. Thank you.